I'm Laura Bonnell, and this is the Living with Cystic Fibrosis podcast coming to you from Detroit. Please subscribe and even rate and comment on our podcasts when it moves you. I learn something new with every podcast, and I'm always inspired by the people that are showcased here. We don't give medical advice. You need to connect with your doctor for that. I hope that this Living with Cystic Fibrosis podcast educates you and sparks some volunteering or advocacy. The CF community needs people like you. Thanks to our sponsors, Viatris and Vertex, for their support. I am excited for you to hear this podcast because this is information you may not be aware of. Brandi Berry is the LLMSW, and she is the program coordinator of the Kent County Children's Special Healthcare Services Program, and this is what we're talking about. She's also the program coordinator for Fetal Infant Mortality Review and Healing Through Grieving, Pregnancy, Infant, Child Loss Program, all of the Kent County Health Department. But Children's Special Healthcare Services Program is in every county in the state of Michigan, and it's a fabulous program. So if you haven't heard about it or you just want to learn more, this is a great podcast for you. Brandi has over 20 years experience in the field of child welfare and human services. She is also a full Spectrum Doula and as well as an adjunct professor with the Grand Valley State University School of Social Work. She is also the mother of 3 children, the oldest of which has a rare disease, and she enjoys all sorts of things, including reading, traveling, and spending time with her kids, and just a wonderful human, as you are about to hear. Brandi, welcome to the Living with Cystic Fibrosis podcast. I'm so glad to have met you at a recent conference in person, and great to have you here. So welcome.
Thank you. I'm happy to be here.
First of all, why don't you tell us how Children's Special Healthcare Services started and what it's currently doing in Michigan?
Children's Special Healthcare Services, it used to be called the Crippled Children's Insurance Policy. And there was a whole Crippled Children's division of healthcare in Lansing many, many moons ago. I believe in the 80s, they changed it to Children's Special Healthcare Services. So what it is, it's Children's Special Healthcare is a very small piece of the Medicaid pie, and it provides insurance funding for people who have a special healthcare diagnosis, specifically children. As of January 2024, the program goes from 0 to age 26. It used to stop at 21, but now we have expanded to age 26, which really brings this program in line with most insurance companies that cover, young adults. So unlike traditional Medicaid, the only qualifier for this particular program is that you have a special diagnosis. So there are over 2,000 different diagnoses that are covered by Children's Special Healthcare. And all of that information is available online. All you have to do is Google Children's Special Healthcare Services, State of Michigan, and all the guidelines and diagnoses will pop up. What happens is if you have one of those identified diagnoses, then you can potentially qualify for the program. And then what Children's Special will do is the insurance covers your specialty care related to that particular diagnosis. And I forgot to mention that, the program stops at age 26, but there are a handful of diagnoses that are lifetime, and those include cystic fibrosis, sickle cell disorder was recently added to that, and then hemophilia. So there's some specific diagnoses of hemophilia that are also lifetime diagnoses.
And it's a great program. From personal experience, I have to say, when we finally found out about it, things have changed because Molly's 29 and Emily's 26. It took us years to find out about it. We did not know, and things are so much better now as far as educating parents and letting them know that it's available. And we didn't need it the entire time of their underage disease, but it was there. And then when the girls turned 18 and were going to college and they accessed it themselves, it was wonderful for them. It's wonderful. So it's a great program. It helps them when they're young adults and they've got their first job. And then, they're off our insurance and they have that as a backup. So it's great. I later want to get into this because not every state has it or they don't have a good program, which my girls have discovered.
Mm-hmm.
I think that Michigan has one of the best programs in the country.
Correct.
Wouldn't you say?
Absolutely. It's very robust here. We do our best to get out into individual communities to notify families. Really, this program starts with healthcare providers. So we do a lot of outreach with healthcare providers and specialty medical clinics specifically, because that's where, those are the services we're paying for. So it's only right that our clients come from those spaces and are made aware of this program in those spaces. The thing about our program, too, that's a little special, in my opinion, because I have personal experience with the program as well. When you get a diagnosis, it's a lot, right?
Mm-hmm.
You're trying to figure out how to take care of your kid. You're absorbing this information. Your whole idea of what's, air quotes, normal is kind of thrown out the window. Everybody wants this healthy baby that they, show us on TV that we're expected, this perfection. And so, we're at a point in our life where we have to really view what perfection is for us and what our new normal is. Because our children are amazing. They are perfect in every way that they come. And now we have to adapt to this new information that we're given. And part of that adaptation is learning how to care for them and then how to pay for it. Some of the medications that our children are on that we have here in this program. So I cover Kent County, all the children's special health care services. So we're an umbrella program. So our family center and kind of the hub of Children's Special is located in Lansing. If anybody has any questions about Children's Special and want some generic information, the Family Center is the best place to start. Again, if you Google the Family Center, it will pop up.
We'll have it in show notes, too, so people can access that.
That's some great information. So the program starts there, but the services are provided locally at individual county health departments. So I believe every county in the state has a office available. Some of the more rural counties kind of might share a health department, but it's available all over the state. And we do our best to make the program accessible to people. Right now in Kent County, we have over 4,000 clients that we serve. I have currently 4 nurses, full-time nurses, and 1 representative. And those 5 people cover our whole county. We're going to be looking to add a social worker and another nurse to our program because since the age expansion to 26, our services have just really taken off.
I wanted to ask you, how does Michigan, this program, keep doing so well? Are we learning and growing? I mean, I don't know. I can't speak for other states, but I know other states, their program just isn't as complete. It's not doing as much. So what are we doing that we're doing so right that maybe other states can learn from us? And other parents who have kids with CF or any other rare disease or special needs who want to advocate, like what advice can we give them?
On a personal note, I would say that I think this program is very accessible. As a parent, I had access to information. And honestly, I found the program myself. So personal note there, my son is now 24. When he was about 6, something was different. I couldn't put my finger on it. Healthy boy was meeting all the milestones, but he just kind of was sickly. And in my experience with other children, their growth and development looked a little bit different than my son. And then when he started school, there was so much angst with school. He just was anxious about everything at school and made him nervous. And then to the point he would throw up. And he would throw up often, 2 or 3 times a day. Well, when educators see vomit, that means go home, right?
Mm-hmm.
But it's like he would get sick and then he would be a few minutes, he would recover and he's fine. A child can't walk through life throwing up 3 times a day. That's not normal. Like, how are we beating you? Like, what do I do? I was a young parent at the time, so I had to do a lot of poking and prodding and pushing of professionals to really understand what we were going through. So I had started doing some internet searches myself. I needed help with my son. I didn't know where to turn. People weren't believing. People, when I say people, I mean professionals, really, because here I am, this young woman. What do I know?
Mm-hmm.
I just knew that my son needed help, and I didn't know how to provide that help for him. And through my internet searches, I found the Family Center. And so I purely just reached out for some information because, I need some help and they won't refer me to anywhere. And they just kind of talked me through what was called, you can have a diagnostic evaluation, and that is covered. We cover that. So before a person is even on this program, if you feel like you might be walking into a space where you're pretty sure that your child has whatever going on, we can cover a diagnostic evaluation. So that diagnostic evaluation, they can be very expensive if you don't have private insurance. And that's usually, those are done by specialists in whatever area that you're looking for. So for us, it was a stomach doctor. I'm trying to think of the word. But here in Grand Rapids. And at that time, the Children's Hospital in Grand Rapids was very underdeveloped. It was at the very beginning stages of what we have, these huge facilities we have now. There was only one doctor who was covering gastric issues in children. It took forever to get an appointment, but Children's Special, again, I wasn't even on the program. The nurses here helped me navigate scheduling and getting on cancellation lists and getting into the appointment. I had a car and all those things, but had I not had those things, there were services available to me. And when we finally got there, like, there was so much information, and the doctor was clear that there was something going on with my son, but it was out of his scope. So they gave us a diagnosis of, I think, gastritis at that point.
Okay.
But they gave us to be seen at Children's Special Hospital in Cincinnati, because those were like they were the forefront of gastric illnesses in children at that time. So we went there, Children's Special. By that time, we had a diagnosis, and so we were covered by the program. So any specialty care related to that particular diagnosis, we were able to see the doctors in Cincinnati. And I mean, we would have to go, that first 3 years, we went there twice a year for a week. So that involved hotel stay. I had another child, travel, all the things, food. But Children's Special helped cover all of that. They helped cover our hospital or our hotel stay, helped give us mileage reimbursement. And it just made something that just seemed a mountain, kind of a molehill. It really helped me climb it. And I'm forever grateful to this program. To answer your question about the robustness of the Michigan program versus other places, I would say this: Michigan is wonderful in that we have very large medical systems here. We have, U of M, we have Michigan State. Here in Grand Rapids, we have the Children's Hospital. So there are just very robust medical systems here. And there's a lot of research facilities, particularly in my area, as well as on the other side of the state near Detroit. There's research centers aimed at looking at these rare diseases and rare diagnoses. Other states perhaps aren't privy to that type of responsiveness to our needs, but specifically those of us who have kids with rare diseases. The research is costly, and then getting people to participate in these trials is difficult. But we happen to be in a state that understands these types of needs, the research needs, and we have people who are willing to participate. And I think that really helps. And as long as we have a robust system that is utilizing this program, I think that's why we've been able to flourish in our state.
Yeah, Grand Rapids has amazing research. And I was just there, when we met a couple weeks ago and took all these tours and saw all these facilities. It's incredible. Like, science and innovation is here in Michigan in just an abundance. We always want more, but it's fantastic to have. And I also think that your story was a beautiful description of the help that people can get with children's special health care. And the other thing I wanted to add, which I know you're going to talk about, is how many parents are involved. Every time I had to call children's special health care or called the hotline, the parent on the other end had a child with either a rare disease or a disease. And they always had helpful information because they were going through the same system or nightmare or whatever it was I was going through. And that is a huge part of why I believe it's so successful.
Yeah. The program is intentionally has spaces that are parent-led. And we do our very best to keep those spaces filled with active parents who want to participate. So here in Kent County, we have a private Facebook page that families can throw out questions on there. Just the other day, there was a mom who was trying to navigate a medical facility and getting a bill paid. And there were parents on there like, tell them you want this instead of that, ask specifically for this. Don't let them, steer you to that. So we do a lot of that, and the parents really help each other. I totally agree. That parent involvement and having the peer support is absolutely foundational in this program and very necessary. And again, I think that's another reason why parents lean to this program and want to participate when they hear about it.
Yeah. And just to kind of put it in a nutshell again, which you have explained it very well, but it's through Medicaid in the state, and then each county can help people. And in those counties, there is a family phone line too that parents can access.
So the family phone line is at the state level.
Okay.
And have questions, they usually can answer it there. Or if it's more of a specific question to your area, they will transfer you to your local health department. But the Family Center is a great place for someone to start. They are unfamiliar with this program or perhaps stuck with a question, don't know where to go. The Family Center phones are monitored by parent support partners, as well as trained state staff members who run the program.
And it's just a very smooth running program as well. Can you talk about vaccines? Because you can also get vaccines for free when you go to the health department, right? It's still part of that same program?
So the vaccine initiative is a state-led program that's very much outside of Children's Special, but we refer our families to that. I am familiar with what's going on here at the Kent County Health Department, but if a person here, I'm sure it's similar across the state. But if you are behind in your vaccine, and some of us don't even know, quick story about that. When I started this position 3 years ago, and as a public health official, they have to review your vaccination list. I didn't know where to even find that thing. Like, I'm sure it's under my mother's mattress somewhere or something.
Yeah.
But come to find out, I needed all of my vaccinations. I needed boosters on everything. So I pretty much had to start over. And I think a lot of adults specifically don't even have that information. You just assume that you got some shots when you were young and it's over. You're done with the series. But that's not always the truth. Some of these vaccinations, like some illnesses, are back. I think on your side of the state, there were a couple of incidents of measles, if I'm correct. Mm-hmm. And so now there's a big push for folks to make sure that you're vaccinated, make sure your children are up to date. The vaccinations are free. If you have questions about your vaccination status, I would encourage you to contact your local health department and they can help you locate your vaccination status.
And I know, too, one of the things that has been worked on over the years is that Children's Special Healthcare is so wonderful, but sometimes the pharmacy doesn't understand it or connect with it, and it's extremely frustrating for parents. Can you speak to that and how it's improved? And if a parent has a challenge like we used to have, they would always say, oh, no, you don't have secondary insurance. And we were like, yes, we do. And here it is. But there is a misunderstanding of what Children's Special Healthcare is and how it's different from the traditional Medicaid that people think of.
So, great question. And to start answering that question, I will say this. When a person agrees to participate in this program, a question that comes up often, especially for parents who perhaps make a larger amount of money, in order to be on this program, you do have to pay a copay. And it's a sliding fee scale. I think the lowest payment agreement is $120, I believe.
Yep, that does sound right. Yep.
To like $3,500, might even be $4,000. So we often have that question like, why is it advantageous for me to be on this program, specifically for parents and higher payment agreements? So as part of this program, you have access to our health department, our nurses here. Our nurses are case managers for our families. And so when things, just like you mentioned, parents will call us panicked. My daughter has this cancer med, or we have to start taking it today. She can't miss a dose of it because it will throw off, everything. And the pharmacy won't give us our meds, or, it's not covered. So it's $10,000. What do I do? I know that I have Children's Special. I know that this is on her diagnosis sheet. So why is the pharmacy giving me so much trouble? And then, by that point, the parents are, near tears sometime. And then the pharmacy is like, we can't do anything. Our nurses are very adept at managing those situations. they know how to process through all of that billable information with the pharmacy to assure that families get the medication that they need. It usually takes us a couple phone calls with the pharmacy, and the parents can stay right there at the pharmacy while we work through it. But on average, we're able to take care of those things when they happen, those incidents when they happen. So when the question comes up, why do I need it? Those are the things that, that help is invaluable in that moment if you are stuck. And then no matter, I don't care how much money you have in the bank or have available to you, who can afford a prescription that's $1,000 a month? I certainly cannot.
Right. Yeah, it was fantastic, especially when hospitalization wasn't completely covered and our girls were hospitalized all the time. Mm-hmm. And like you said, it's everything related to your disease. So it's not like if you're going to the dentist for something unrelated, but it is and was wonderful to have access to that. And unfortunately, which obviously it doesn't carry if you move to another state like my girls have done, but it is a wonderful thing. And I also wanted to ask you, so there's only 3 diseases that are covered into adulthood.
Correct.
And fortunately, sickle cell is now one of them. CF has been on for as long as I have known it. The program has been on, and I think hemophilia as well. But what does it take to get your disease on there? Is it a really long, hard process? And why only 3?
That is a great question for the folks at the state level. I'm sure that it takes some legislation to happen. I am positive that they have to, it's a funding thing, right?
Mm-hmm.
Yeah, that's a great question for the folks at the state level.
Yeah. For this podcast, we will just stick to the actual program, mm-hmm. But what are some of the other benefits of Children's Special Health Care Services program?
Wow, there are so many, and it's unique to whatever your family situation is. So last summer, we helped a family get some air conditioning units in their home because they have a severely asthmatic child in the home. The air in the home was just too stagnant, and it was triggering this child's asthma. So working with their medical providers, we were able to do that. We helped get ramps. Anybody who's ever had to pay for having a ramp built out of your pocket, your own pocket, you know that it's actually an undertaking. It sounds simple, right? You just put a ladder on my steps and, so I can roll out the house. But no, it's a whole thing. And depending upon where you live, sometimes it requires some changes to the architecture of the home. And you have to have all these folks come out. It's a whole thing. And our nurses can help walk you through that. We have helped get families build lifts in bathrooms when as children age. And, I can no longer carry him or her to the bathroom for a shower. Wheelchairs is something that we work frequently on and other medical equipment. Wheelchairs are costly, especially as, again, children age and go from the child wheelchair, which is very expensive, I learned. But to the adult, that transition to the adult wheelchairs can be an astronomical price to some folks. And you mentioned about insurance. The thing about our private insurance, those of us who are blessed to have private insurance through perhaps an employer, most folks don't look at that fine line. You just sign up for one, whatever the one your employer is pushing you to have, because at that snapshot of moment in your life, everybody's fine, right? So you're not planning for a $10,000 hospital stay for one day. And your insurance only covers $5,000 of that. Nobody really I shouldn't say nobody. The average person doesn't read that stuff. So that we have those conversations with families too when they call, like, why would I want this program? How does it help me? You really have to know what's going on with your personal health insurance to know how this program would benefit you. And we find that a lot of times folks don't know.
And I was wondering, how many people do you think in Kent County or maybe throughout Michigan could have access to these programs and don't know about it? I mean, I think that, I'm working with a group that's trying to get the word out about children's special health care throughout the state, but it's still hard for reasons that you've mentioned. Parents are overwhelmed at diagnosis and et cetera.
Great question. When I saw this position was available, and I interviewed and I prayed about it and ultimately was offered the position, my first couple of weeks here, I was really looking at our numbers. Again, I've been here 3 years. At the time, we had a little over 3,500 people on the program. Now we have swelled to 4,000 and growing. Statistically, our numbers, even though they're large, we only have 4 nurses, are not very representative of the community. There is a disparity between racial. It's not racially diverse. It's not economically diverse looking at our community. The majority of the people that we serve here at our health department are working folks with private insurance. Dare to guess that there are lots of other people that can benefit from this program, but they don't know. So it has been kind of my personal mission to really make sure that we're getting out into the communities and sharing about this program, making sure that professionals really understand that anybody could potentially qualify as long as they have a special diagnosis or a rare diagnosis, helping people understand, there's also this myth that, okay, well, this family is already receiving Medicaid. So would they qualify for children's special? Well, yes. So even if you're already a Medicaid recipient, there is a piece of the Medicaid pie. Again, that's different than traditional Medicaid. So making sure that this family is also referred to the children's special piece of Medicaid to work in tandem with their traditional Medicaid. And that does not always happen. I have found that many times professionals will think, well, they're already on Medicaid, so what's the purpose of filling out this paperwork? There is a difference because that opens up a window of case management that perhaps this family didn't have before.
I'm sure there's some shame to it for some people. They think, oh, I don't need that. I know initially I thought we're a 2-income family. Like, we don't need this. But it has nothing to do with how much you make. We've always had private insurance. But after a while, I thought, well, why wouldn't we utilize this program instead of paying out of pocket just because we think we don't need it? And like you said, once you get involved in the program, you find out all the different programs and how much help there is for parents. So I would encourage everyone to check it out and don't be afraid to explore the program because I think it's such a benefit. And then once the girls did it independently, it was very helpful to them as well.
Right. Explore the program. I love that you say that. Sometimes people will join the program. Like, again, we have over 4,000 people here. But we've been doing a little bit of auditing our cases and reviewing our work. And there are folks that we haven't heard from in, 5 years. They still are on the program. They're active, but they haven't probably needed anything. But even though you don't need anything per se, your bills are being covered and all of that, there is such a community of people available to you. As a parent with a child who has different needs, sometimes your own natural supports don't understand. And perhaps they don't get, just the struggles that you have with parenting someone who looks different, being in a world that's not adaptive to your child's needs, educational system that does not understand your child's needs. All of that is not something that insurance can cover or address. Our support group, we host a support group here at our health department quarterly. Our support group is a place where parents come and unpack that sort of stuff and they share with each other and become natural supports for each other. And it's just great to be in a space where you're with other folks who are experiencing your same struggles, because parenting from the lens of a parent with a child with different needs is very different. It's a different experience than someone who does not have these diagnoses.
And I also think that you and I can relate to probably the same thing on every level, from insurance, from challenges to diagnosing your son and us, our daughters. Mm-hmm. If you have a child with a chronic illness or a rare disease, like, we have all been through the same stuff,
Absolutely.
The same challenges. And that's what's beautiful about being connected with other parents in this program. What kinds of things in Kent County are you really proud of that you're facilitating and doing through your program?
Our support group was amazing. It ebbs and flows. After COVID, getting parents to bring their very delicate children out was difficult, understandably. And during our support group, we serve dinner. There is childcare available. and the parents just go into another space and we're able to just breathe and have very candid conversations. So the support group is something that will always be near and dear to me. And that had been going on for many years prior to me. The person who had been in this position for over 25 years was Chris Buchek. And she really put her heart and soul into developing that support group and keeping it going for many years pre-COVID. So keeping it alive is something that I really do in her honor, and I'm happy that we are able to keep it going. We also host an annual back to school bash. This year will be our 3rd year. Our back to school bash is a little bit different from traditional back to school events, in that everything we have here is specifically curated for children with special healthcare needs. We give out backpacks with adaptive school items in it. So, different size pencils, little grippy things on the pencils. We give out fidget type stuff because sometimes one year we gave away the little, I think they're called like seat treads, and they're for like elementary school seats where a kid can put their feet up and kind of dangle their feet on these things instead of when they can't be still on the floor. It gives them an extra space to play on. So we have or move around, I shouldn't say. Play. We have all sorts of things that we try to put in the backpacks that we give away. And then we bring the zoo here. We, 1 year in one of our support groups, we had a parent, like we were talking about, what are you going to do this summer? And some folks were talking about, this year I think I'm going to try tackling the zoo. I had not even thought about how difficult it is for some families to go to the zoo. Never mind the stares and the disapproving looks that you get from society. But I know here in Grand Rapids, our zoo, when you go in, it's on an incline. Imagine carrying up a child with his or her equipment, the stroller, the wheelchair on an incline, how difficult that is just to get in the entrance. I had not even considered that. So every year we bring the zoo here. They come with a couple of animals that the children can touch and have an educational experience with.
Wow.
The sheriff department comes and brings the mounted horses so the kids can interact with the horses here. The health department has the vaccination van that will come. Last year, I think we gave they gave out over 50 vaccinations, which was amazing. We invite all sorts of agencies that deal with matters related to our children who receive our programs. So it's just a really cool event. We serve dinner. Last year we had a cakewalk. Our theme last year was the carnival. And some of the kids were like, we've never been able, the parents, they've never been able to do a cakewalk at the school carnival because there wasn't space for a wheelchair. Well, just those things that
wow.
think about. And so the kids got to win cakes and they were just so happy and proud. Last year we had a sponsor with Country Fresh ice cream, and they gave away ice cream. And we just had music. It's just a good time. So that is August. And look at my calendar. I don't want to misspeak myself. It's Tuesday, August 13th. That is one of my favorite events. Every year it's growing, and we hope to have a little bit larger event this year. So yeah, I'm just really proud of the work that we do. We'll be hiring a social worker soon. So our social worker will be able to attend IEPs with parents and 504 plans with parents, because schools don't understand when it's a 504 plan and it's just a healthcare need. So what does that mean? Like in my child's situation, he needed access to the bathroom. No, he's not in there playing. No, he's not doing all the things. And there was one teacher that refused to honor that. And so my son was in the 3rd grade and he actually sat in the back of the class. He vomited on himself. And in that process, he also defecated on himself. How embarrassing when he could have just went to the bathroom and he just needed access to the bathroom. But this teacher refused to honor his 504 plan. Yeah, our nurses can walk through all of that with families, and our social worker will be able to attend those meetings. And then, we have clients here who are receiving private duty nursing. So our nurses case manage those families and help with those needs. And then we have some families who are at a crossroads where they're experiencing the transition of their child, or the imminent transition of their child, or they've just experienced the loss of their child. So our social worker will be able to assist those families, because we also have a program here at our health department a grief and loss program that a family can get 3 home visits for if they've experienced a pregnancy loss or a loss of a child. So there's just a lot of opportunity here, and I'm excited for it.
And you must be hearing great stories. I hope you're getting good feedback other than just what you see from parents about how these programs have made a change in their lives.
Sometimes, and we as parents are busy, right? So when something finally goes right or we finally get the help that we need, you might say thank you in that moment, and then you have to move along because there's always 10 other things, right? But on occasion, we'll have parents come back and it's like, that was an awful year and your nurse was there at the NICU with me. I want to thank nurse so-and-so, or, I can just think last week there was a mom who the insulin is expensive. I don't think that, you don't have a child who has these needs. You don't even, it's out of your realm of thinking. Insulin is like ridiculously priced for it to be something that a lot of people are utilizing. But this mom was like, I have $5. I cannot afford this. I think the prescription might have been $300. And the pharmacy was giving her the runaround. And it was a simple 20-minute call for one of my nurses, but it made all the difference for this mom and eased her worries in that moment. So, yes, we hear some things. And in other situations, we just acknowledge that we did our part, we did our job, and that is sufficient.
And I think, too, the advocacy early on when I was still learning about the rights of my daughters in school, it was really important to be empowered by, the 504, everything, even when they went to college. And I know at least one daughter had 2 experiences of being denied her rights, and my other daughter did once, but they knew their rights. So they did stand up for themselves. And it was in this case, or one of the cases, when my daughter was sick in college for 3 days. Because of the law, she has 3 days to make up that work. So the teacher didn't believe her and didn't know. And she's like, well, here's the deal. And provided that information. So I think there's so much that Children's Special Healthcare offers that parents aren't aware of. What else did you want to mention about either your program in Kent County or Children's Special Healthcare in general?
It's an amazing program. I would encourage families, if you have a potential diagnosis that you are struggling to get some help, or a new diagnosis, or you're just questioning, you just have questions, reach out. Get some information. It's difficult having a child who's different, right? So I encourage all people to learn more, assist the people that you know in your life who perhaps are struggling with something new that they've learned about their kids. Just, give grace to people. It is hard out here already, but when you then encounter these moments in life where you try to make sense of it all, and then on top of that, you have the judgmental friend or the judgmental family. It just makes it more difficult. But give grace to people. And, it does not hurt to seek information. So if you have questions, reach out to your local health department.
It's so beautifully said. And I really appreciate you sharing your personal story with your son. It's so helpful when people like yourself are honest about challenges and how things were helped, because I think it makes people feel like, I can open up about that, or I can say, hey, this is a challenge. And you really learn to advocate right away because you're trying to help your kids. So thank you so much for talking about this program. Even though it's a brief discussion, people can find out more information. And thanks for all you're doing, because it's really important to so many.
Thank you so much. Thanks for having me. This was great.
The original music in this podcast is performed by Kevin Allen.
It's not complicated.
Who happens to have cystic fibrosis.
We all got our worries and fears. I know it's got you frustrating, but loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, visit our website at thebonnellfoundation.org. That's the BONNELL Foundation.org. This podcast was sponsored by Vertex Pharmaceutical, The Science of Possibility, and Viatris. It was produced by Jag Detroit Podcasts. Follow our show in Apple Podcasts, Spotify, or wherever you're listening right now.